Just a few housekeeping reminders. Everyone is muted, so if you have a question, please send it in the chat box. You can send it to myself or to the presenters, but definitely have me included, and I'll be sure to ask the question on your behalf. The presentation will be lasting about 2 hours or so, so sit tight and enjoy the presentation, and I will pass it over to Lee.
Thanks, Brendan. Hi, good morning. I'm Lee Howard from Diana T. Myers & Associates. We are the Continuum of Care consultants for the Eastern PACOC as well as the Western PACOC. And each year we host this PIT webinar, so thanks for registering and joining us. We usually have sort of a couple of different presentations from different counties with best practices that they're using. We're doing things a little bit different today. Joining us to co-present are Maria Williams from the Pennsylvania Coalition Against Domestic Violence and Brendan Auman, who you just heard from, who is going to talk us through a new component or a new option, I'll say, for this year's PIT count. So we sent out a survey. We got a pretty significant number of responses. I think out of the 53 counties in East and West, we got input from over 40 folks participating and leading really their local count. And there were more than a few folks who said they were newbies this year. So for those of you who have been doing this for a long period of time, just know we're going to get to the stuff that you are probably most interested in hearing, but felt like it was really necessary to take a step back this year. So I'm just going to cover some really basic things very quickly. And for those of you who are newbies, please know that you likely will have questions beyond just what's presented today very quickly. You're always welcome to reach out to myself or to our two COC staff folks, Leah Daugherty and Sierra Carnes, Leah in the East and Sierra in the West. And we can either answer your questions or help put you in touch with the county contact somewhere else to hopefully share their best practices and lessons learned, et cetera. So for those of you who are newbies, what is the PIT count? A census or a count of all people experiencing homelessness on a single night. It includes some basic demographic information about the individuals that are encountered. And this is articulated and sort of mandated, if you will, by HUD each year through an annual HIC PIT data collection notice. And if you don't know what HIC is yet, don't worry, you will in a few minutes. So overall, the HUD requires the PIT count. This is required through the McKinney-Vento Homeless Assistance Act. And the legislation actually indicates that, or I should say the regulation indicates that the PIT count is required every other year, but the annual NOFA, the Notice of Funding Opportunity for Continuums of Care, incentivizes and requires the PIT count to actually occur annually. Just wanted to clarify that in case you decide to catch up on your regulation reading in the near future. So what does the PIT count actually include? The PIT count really has 3 different components. We're going to talk very, very briefly about 2 of these, but the majority of our time this morning will be devoted to discussing the unsheltered PIT. So overall, the PIT count includes the development of a housing inventory chart, the conducting of the sheltered point-in-time count, as well as the unsheltered point-in-time count. The way that we sort of go about structuring today's webinar, the methodology that is submitted to each governing board for approval, and the guidance that we provide to local counties is all really sort of comes from this document that HUD put out back in 2014, the point-in-time count methodology guide. In addition to sort of laying some ground rules for the PIT count, it includes lots of best practices. It also includes certain language that HUD then asks the COC to certify and verify that they adhered to this particular methodology that's laid out within the guide. Those questions are asked each year during the annual continuum of care application. So we're not going to necessarily go over the 14 standards, but just know that throughout the planning process and some of the background work and integrated into this webinar and elsewhere, there's information that is designed to specifically adhere to these 14 standards. Again, this slide is really designed for folks who are newbies. In case you aren't familiar with the sheltered and unsheltered PIT count, really what is the definition? So in either case, we're looking to identify folks who are homeless per the HUD final rule. So for the sheltered count, that really focuses on individuals who are in emergency shelters. Emergency shelters is as broad as including folks who are in a hotel or motel that's being assisted with faith-based resources, with county resources, with from philanthropy, any sort of hotel motel voucher that's provided. It also includes domestic violence shelters, in addition to transitional housing programs and safe havens. Safe havens is listed there because that's part of the HUD language. We don't actually have any officially designated safe haven programs any longer. For a number of years, we had them in Washington and Westmoreland counties in Western PA, but those projects have been reallocated and are now sort of taking a different shape. Unsheltered PIT count, who does that include? Really includes individuals and families whose primary nighttime residence is a public place, not designed for or ordinarily used as regular sleeping accommodation for human beings. I just want to clarify that is not my language. This is directly from HUD. So what does that really include? It includes folks who are sleeping in a car, in a park, in an abandoned building, a bus or train station, an airport, campground. There's a number of other potential locations that we'll sort of quickly review in an upcoming slide. So when is the PIT count conducted? Per the COC regulations, the PIT count is required to be conducted during the last 10 days of January each year. The Eastern and Western PA COCs have opted to conduct our PIT count on the fourth Wednesday of each January. So this year's date will be Wednesday, January 23rd, 2019. There's always some question and confusion about what part of the day are we really talking about. So HUD provides this little graphic that I included this year. As you can see here, what they're really looking at is the overnight hours. So assuming that if your PIT count, I don't know, starts at 10 p.m. on the 23rd and ends at 2 a.m. I realize a lot of folks do not necessarily do a 10 p.m. to 2 a.m. PIT count, but it's the easiest sort of way to demonstrate what this image is trying to say. So what you're really looking to do is to identify those folks who are in an unsheltered situation the night of January 23rd. So when you start at 10 p.m. on the 23rd, you're looking at where are folks sleeping now. When you end on Wednesday the 24th, you're still looking at that same time, right, assuming that they were there overnight. What this also means is that we're going to talk about this a little bit more in an upcoming slide. But regardless of when you actually conduct your count, you're referring back to that same period of time, those overnight hours between Wednesday evening and Thursday morning. So again, we'll talk about where that comes up and where it's important and how it's going to sort of drive how and when, or excuse me, which specific way you ask this question in an upcoming slide. Again, for folks who are new to the PIT process, I just wanted to provide a very quick snapshot of highlights of the PIT timeline. This is not an exhaustive list by any means, but I know that many counties have already started doing their county level planning meetings. If you haven't, I would encourage you to start soon. We have today's webinar. Later this month, before the end of the year, we will be distributing a number of different things, including the Unsheltered PIT interview forms. What's not listed here, which should also be listed in terms of December 2018 or probably the first week of January, will be the Unsheltered PIT training for volunteers. We're making some pretty specific changes to that document as we speak, and I believe it'll be out by the end of the year, but in the event that it's not, it will definitely be out the first week of January. Also, again, Leah and Sierra, our two COC staff folks, will be reaching out to sheltered programs to confirm that we have the right contact information, as well as just to confirm programs are continuing to operate, to ask if there are any new programs within their county, or if any programs have closed. Again, that's specific to the sheltered count, but part of the overall PIT timeline. In January, we will be doing an HMIS data quality check of sheltered programs. I'll explain more in a few slides what that means. As you can see there, January 23rd, we have the PIT count date. I think it's the 13th of February, all data will be due to our office. And then during the months of remainder, what it doesn't say here is the remainder of February, we will be conducting follow-up with questions that occur, as well as folks who are late with submitting their data. So please don't be late. March and April, we will be doing data entry for any data that's submitted on a paper interview form. We do work around checking for duplication of these forms, which happens sometimes if folks, multiple teams or groups are crossing the same area. Follow-up with questions, obviously, and then April 30th is the due date for the data to be submitted to HUD. This is submitted using an electronic portal called the Homelessness Data Exchange. And then before June 30th, we will ensure that we have the county-level PIT reports developed and distributed. Those are posted on the COC website. If you have any trouble finding them, you can let either myself or Brendan know. If you haven't seen them before, they're really helpful. It takes the data that's submitted to HUD and breaks that data down to the county level and then provides sort of a 3-year snapshot to show a trend. So this year's data showed 2016, 17, and 18. And so that will be out by or before June 30th. So before we get in too much detail about the sheltered or unsheltered, I just want to say there's a big change for 2019. I know those of you who received the email information about registering for today sort of have some sense as to what that means. But the big change really is not from HUD this year. There's most of the requirements set forth in their annual notice are consistent to last year's rules. The big change for us, though, is that Brendan has been working very hard to develop a mobile app, not actually develop the mobile app, but to help customize a mobile app that was developed in partnership with HUD for our continuum of care count. So we're going to talk about that. Brendan's going to do a demo at the end of the webinar, and it's pretty exciting. The mobile app will be able to be used with either the sheltered or the unsheltered count. And again, we'll talk a little bit more about that as we move through the webinar. So starting very quickly with the sheltered PIT count. The real components of the sheltered PIT count are, that, as I said before, the HIC, the housing inventory chart, and then also the PIT, the point-in-time count data. So this is just a very quick snapshot of a partial, a part of a spreadsheet that was developed for the housing inventory chart. It's extraordinarily wide, so the whole document is not readable if I really post a screenshot here, but the idea of providing this is just to give you a sense as to the kind of information that needs to be collected. What is the funding source of the program? Is the program participating in HMIS? What are the number of beds and units for families, for single individuals, for unaccompanied youth? Are there beds that are designated for a particular population? That would include veterans beds, it would include youth beds. Programs are also coded differently if they are domestic violence programs. In addition, we summarize the year-round number of beds as well as seasonal beds and overflow beds if those are available within the program. And we also provide within the housing inventory chart a PIT count number. So we say our inventory is such, which really is talking about the capacity of beds, and then our PIT count number, which is the number of people who were in the program that night. And so that's a very, like I said, a very quick summary of the housing inventory chart, but it's a really important component of the overall PIT count. What programs are included in the housing inventory chart? Again, emergency shelter programs, which include hotel motel vouchers as well as domestic violence shelters. Transitional housing programs, regardless of funding source. I know that has been a question for folks. Rapid rehousing projects, again, regardless of funding source. Permanent supportive housing, and what I'm realizing now that it does not say here is other permanent housing. That would be other permanent housing projects that are dedicated to the use, dedicated for use by individuals who met the HUD homeless definition upon entry. We previously didn't have many of these programs, but we are having more and more each year as programs have been reallocated or voluntarily reallocated, who have a covenant agreement and are required long-term to serve individuals experiencing homelessness within that building. Many of those programs have become permanent housing and have been added to our other permanent housing inventory. So I get a lot of questions every year around we have this new program in our community that is designed to serve whoever, people exiting prison, people who are exiting drug and alcohol rehab programs, and any number of other situations. Or we've always had this program in our community. We've never included them in the point-in-time count. We're not really sure why. Should we add them? So I thought this would be a helpful slide to include. Again, this is HUD's language, but I'm going to read it to you, and then I'm going to sort of break it down a little bit more. Beds and units in the housing inventory chart must be dedicated, that's one of the key words there, dedicated to serving households experiencing homelessness, or for permanent housing projects, that would be rapid rehousing, permanent supportive housing, or other permanent housing. So for those projects, dedicated to individuals who were homeless at entry. So for the purposes of the HIC, a project with dedicated beds or units is one where the primary intent of the project is to serve individuals experiencing homelessness. The project verifies homeless status as part of the eligibility determination. And C, the actual project clients are predominantly homeless, or for permanent housing we're homeless at entry. And I'll explain that C because it's sort of awkwardly written. So the main point here is that is the intent of the project to serve people who are experiencing homelessness. Does your local community consider this project to be part of your local sort of resources to address homelessness? The other really key part of this is, in fact, B. Is there some sort of process by which homeless status is discussed, is determined? Obviously, the formality of that may look different from program to program. If you have a mom and pop shelter, they may not have an extensive verification process. It may be a couple of questions designed to determine if this person does in fact need shelter on a particular night, as opposed to a program that receives federal funding, et cetera, there may be a more formalized and extensive and written homeless verification process. So that's going to vary from community to, or not from community to community, but really from project to project. But the idea is that it's, again, the project really is looking to serve folks who are experiencing homelessness, and there is some sort of checks and balance to ensure that that's really who the project is in fact serving. C, if you read the HUD notice, basically what C indicates is that if you have somebody, for example, a low barrier shelter, where an individual may come into the program and is intoxicated upon arrival, and there's not much information that you can really gather from the individual when they arrive. If you find the next day, once this individual is sober and available to go through some sort of assessment or enrollment or whatever it is, process that that particular shelter has, and you find out that they were not, in fact, homeless. They just, for whatever reason, entered your shelter for the night. That's okay. That doesn't count as a program that is not really a dedicated homeless assistance program. So hopefully that makes sense. Hopefully that's clear. Obviously, if there are questions about a particular project in your community, and this guidance from HUD doesn't make it any easier to determine whether or not that project should be added to our process, please feel free to reach out to me or to, as I said, Leah or Sierra, and we can discuss this in greater detail based on the specifics of the project in your community. So another thing that I just want to point out is that beds in institutional settings not specifically dedicated for persons who are homeless, such as detox facilities, emergency rooms, jails, et cetera, should not be included in the housing inventory chart. So anything that would be considered institutional, again, if there's a very specific project in your community and you're not sure if it really falls to this or not, please feel free to give me a call. The other thing, it's not on this slide, but I do want to mention, because in some of the eastern and western continuums of care, in more rural parts of the COC, you may have a project that is part institutional. And the majority of the people in that project would not qualify to be counted in the PIT count, nor would those beds be included in the housing inventory chart. However, if, for example, there were a 10-bed program and they had 2 beds that they had set aside and designated for people experiencing homelessness, those 2 beds, and I would want to discuss this with you if you have a program that's similar to this, but those 2 beds could in fact be added to the housing inventory chart so that they are sort of noted as a resource in your community. And any individuals who are in those 2 beds on the point in time count date would be included in the PIT count, in the sheltered PIT count. So again, it may look slightly different depending on the type and level of resources available in your specific community, but that's the one caveat I want to just place on that last bullet there. For whatever reason within the HUD document, they also go sort of out of their way to indicate and articulate that extreme weather shelters are also to be included in the housing inventory chart. So if you have projects or shelters or some type of facility that opens in your community on a code blue night or you know, some other type of extreme weather situation, again, that would be a program that you would want to let us know about if we don't already know when we reach out to update our county level list. Okay, always confusion here. This is not specific to newbies or old timers. There's just always confusion around this. The housing inventory chart data collection tool. Every year we send out an online survey that every single project that's a homeless assistance program needs to complete, regardless if you're on HMIS, regardless if you're emergency shelter or transitional housing, which participate in the PIT part of the sheltered count. All projects, rapid, permanent supportive housing, every single project type needs to do the online survey, please. Even if your project is in HMIS, I know I said that, it bears repeating. The reason why is because the other information that we collect from you is really related to the people in your program, including the data from HMIS. You may have 10 people on the PIT night in your program, but you might have 25 beds. So we need to confirm the number of beds that exist in your program. I recognize that there are instances and reasons that those numbers fluctuate. So it is imperative that we have the opportunity to update that information each year. So things that the online survey request includes capacity. What is the total number of units and beds? It's regardless of the occupancy of those beds. We're really looking to understand the capacity. Secondly, the configuration of the beds. Do you have a large building with X number of rooms? Do you have more of a mass shelter where you have, multiple large rooms that have housing for multiple households? What is the funding source? Is there a particular target population? And we also just ask how many people were in your program. So again, if you're an emergency shelter program, if you're a transitional housing program, we're also going to receive that number through your PIT data, but it gives us a way to sort of do a check and balance. If you tell us you have 11 people on the online survey for the HIC, but we only received 10 interview forms, we know that there's a discrepancy and that we need to follow up. So again, it's just a way for us to ensure checks and balances. Okay, so we're moving from the HIC to the shelter point-in-time count. As I stated already, this includes all emergency shelters and transitional housing programs. Again, if you look through the HUD language, you will also see safe haven programs, which I did not include here because we don't have any officially designated safe haven programs. The data source for the sheltered point-in-time count data will be one of 3 different data sources this year. HMIS, and I'll explain which programs that will include. The paper interview forms, which those of you who've done this for a long time are very familiar with. Or thirdly, the mobile app, which will be available to not only the unsheltered process, which is really what where this started, but also there's a way to utilize the mobile app for the sheltered process. What's cool about it, and Brendan's going to talk more in detail about this, is that if your shelter or transitional housing program either has mobile technology, tablets, whatever, that can be used. If not, you can also just use a regular desktop computer, laptop, whatever, and collect the data that way. So if you are an emergency and transitional housing program who uses HMIS, first of all, I just want to say thank you. And secondly, you will receive a notification from our office indicating whether or not we can use your HMIS data for the PIT count. If we cannot, we will be asking you to either conduct the interviews either using the paper interview forms or the mobile app. The determination of that is made on a couple things. One is the folks at DCED who operate HMIS run a report for us that we review and look at things like how frequently are you logging into HMIS, when is the last time you had somebody enter or exit your program, things like that, to make sure that it appears that the data is frequently updated and will have sufficient data quality to be used for the PIT count. Like I said, if it's not, you'll be notified that we can't use it, and we will also confirm that we can. In the past years, we've sort of sent out a list of all projects with check marks in different columns indicating what needs to be the data source for your PIT data. And like I said, if you're not on HMIS, all other projects will collect their data using either the paper interview forms or the mobile app. That can be a program level decision. We may reach out to you at some point. I'm not sure yet if this is necessary to ask you to sort of designate whether or not you're going to use the interview forms or the mobile app. I would encourage folks to consider at a project level choosing one or the other. The reason is because it may make it challenging to ensure that A, you interviewed everyone, and B, that you did not sort of have staff in different directions double interviewing any particular household. Hopefully that wouldn't happen. The interview form and the mobile app includes a question designed to prevent that, but things happen. Okay, so as I stated already, the main focus of today's webinar is the unsheltered PIT count. So we're just going to go through the when, where, what, whys very quickly, and then move on to other parts of the presentation. So as already stated, the unsheltered PIT count, same date as the sheltered PIT count, January 23rd, 2019. As already indicated, this refers to those overnight hours between Wednesday evening and Thursday morning. The real reason the slide is here is the note there. So I just want to emphasize one thing, which is that the date cannot be changed by one county or a RAB within the COC. This has happened in the past that there were some conversations about, oh gosh, we're going to have really bad weather and we need to delay our PIT count. If you know a couple days before your PIT count that, you know, a 12-inch snowstorm is coming, please reach out to me to discuss. The issue is that one of the standards that we have to adhere to is that the entire COC must use the same date to conduct the PIT count. So if one county or a portion of the COC determines that they need to delay their PIT count, that may not be a problem. The issue is we just need to talk through what that looks like. If we need to delay, for example, for one day, you needed to do your count on Thursday night instead of Wednesday night, that would not be a problem because you would just ask, where did you sleep last night? If it's a situation where the count needs to be delayed by several days because you've got a lot of snow and you don't have any ability to get your volunteers out to conduct the count, et cetera, it becomes a logistical nightmare. We need to sort of do some additional brainstorming around how are we going to make sure that when we ask folks where they were on Wednesday night, that we know and they know which night we were talking about. So we would just talk through, like, how can we adjust these questions to say, oh, remember the night the storm came? Where did you sleep that night, or something like that. The other thing that can happen is typically when weather impacts the PIT count, it does not impact the entire COC. It may impact, for example, in the west, the northwest, but not the southwest. It may impact, you know, the Pocono RAB, but not South Central RAB in the east. So my point of bringing that up is only to say if we had a situation where the entire COC or the majority or significant portions of the entire COC were blanketed with snow, that is an example of a situation where we would seriously consider delaying the PIT count. Because of the level of coordination that goes into community partners, volunteers, et cetera, that's never the direction that we prefer to go, but sometimes it just is a necessary thing that we have to do. In a single county COC or in a couple of counties, this is far less of an issue and far less important than it would be for our 33 counties in the east and 20 counties in the west to coordinate a date change. So appreciate your mindfulness around this, and just please, again, reach out to me directly if something comes up. And we religiously check the weather that week. Everybody swears that somehow or another the fourth Wednesday of January is the coldest day of the entire year. It probably is the case. I promise you we have no control over that, but yeah. Okay, so again, where is the unsheltered count conducted? Most of these locations were listed on one of the earlier slides. There's a couple that I don't think we necessarily touched upon. Hunting cabins would be one that we haven't talked about. Tents, campgrounds, barns, abandoned buildings, chicken coops, railroad cars, storage units, lumber yards. If you find out in advance of the count, or even if you collect data from somebody that you weren't sure should they count or not, this is one of those things I'm happy to talk about. We actually had so many good questions that came in like this last year that I submitted it to HUD and got a call from their sort of senior person who oversees the PIT count, who was really amazed to hear, just some of the unique challenges that occurs in very rural communities in terms of, an individual living in a chicken coop or in a trailer that lacks heat or other situations. So if you have examples in your community, they don't neatly fall into one of these categories and you would like to discuss, again, please reach out. Okay, where does the unsheltered count not include? Okay, so we talked about the fact that hotels or motels vouchers are included in the sheltered PIT count, but they're not included in the unsheltered count. So I want to pause and talk about that for just a minute here. Same goes for shelters, transitional housing, or other permanent housing programs. So in some communities, and this varies really largely across the state, in some communities, folks conducting the PIT count may have access to hotel motel vouchers. And if they encounter someone, they may offer them to come in out of the weather, to stay in a hotel or motel, or to transport them to a shelter or something like that. If your community does this, I just want to clarify, if you transport somebody or connect that person to a resource, that person then becomes sheltered and should be counted under the sheltered count as opposed to the unsheltered count. So if that's the case, no worries. What I would really strongly ask you to do is to just, as simple as if you're using the paper form, cross something out or make a huge note somewhere that says, person that basically summarizes this individual was identified as unsheltered but accepted, a shelter bed for the night. The key will just be to, if you transport that individual to the shelter, who's going to, how does this person get reported to the COC? Are you going to take your unsheltered count form and write, I took this person to 123 Main Street Shelter, or is 123 Main Street Shelter staff going to conduct an interview or take your interview form and enter it into, to be included with their data? There's no right or wrong answer. It just needs to happen one way or the other and not both. We want to make sure that that individual is not counted as both unsheltered as well as sheltered. So that's a local coordination issue that I would encourage you all as county coordinators to really determine how that's going to happen, or the night of the count, if you are transporting folks, that it happen on a case-by-case basis, that you sort of just confirm at the time of transport how that person's data will be submitted. So in terms of locations not included in the count, hotel, motels, shelters, I already mentioned, jails or prisons. So if somebody had been unsheltered for 10 years, and for whatever reason, 2 days before the PIT count, they were arrested and sent to jail, you still cannot count that person, even if they're getting out in 2 days. If they were not in an unsheltered location on the PIT count, they're not included. Similarly for an emergency room, if you have an individual who is known to be homeless to the community but happens to be in the hospital or an emergency room for that night, they still do not count. Halfway houses, recovery houses, residential medical facilities, youth in custody of state and foster care, other out-of-home placement, doubled up in the homes of family or friends. I think some of those folks are really clear about. Some of them can get a little murky. Again, this is about the unsheltered count. All right, so what are the different ways that we conduct the unsheltered count? There's really 3 different approaches, and many folks, if you consider the various hybrids that occur, there's probably more than 3, but there's really sort of 3 main buckets of methodology that's used. One is the street-based count. which includes either a complete coverage, which I'm going to define in just a moment, known locations only, or again, a hybrid of those two, combining both a complete coverage for certain portions and only known locations in other portions of the community. Some communities also opt to, or instead opt to, conduct a service-based count. And then another option also is some communities host a come and be counted type of event at a particular location. So just diving into the street-based count a little further, the street-based count, which can be called any number of different terms, there's many different terms used to describe the street-based count. But the point is that it is conducted typically by walking around, sometimes based on your community. It could be driving around the community seeking to identify individuals or families who may be experiencing homelessness. So this happens in a couple of different ways, as I just alluded to. Complete coverage. If you have the volunteer capacity and the organizational ability to really sort of sweep the entire county, that would be considered complete coverage. Similarly, what can happen is that perhaps you know that there is no point completely covering a county because there's gated communities, there's neighborhoods that perhaps even you live in that individuals experiencing homelessness are not known to be seen or identified. Perhaps there are extreme areas of your county that cannot be easily accessed because they are in the depths of the forest or whatever the situation is. The peak of a mountain. I mean, we have a very diverse, geographically diverse continuums of care, and I do expect that there are certainly specific portions of your county that cannot be easily accessed, especially on January 23rd. Based on weather. So in that case, what some communities choose to do is to focus in perhaps on, the county seat, if that is an area where folks experiencing homelessness may be more likely to be identified and observed than other parts of the county. Perhaps you have 3 or 4 towns in your county that are more downtown-like than just sort of rural. In that case, it may make sense to identify teams or volunteers to sweep each of those towns. It can look different in your community based on a number of things, including your volunteer capacity, the size of your community, the density, the population density, and the density of individuals experiencing homelessness, the data that you have that identifies where folks are typically known to congregate or known to sleep if they are experiencing homelessness, et cetera. In some communities, they really just focus on those known locations. There's no real attempt to drive through back roads and sort of, weave throughout the entire county. They identify, 20 different locations and deploy teams to those locations to seek to identify individuals experiencing homelessness. And in some communities, they do both, right? They may have a process or a system by which they partner with the local police or EMT or whoever that says if you are out and about on this night and you see anybody anywhere in the county who may be somebody who's experiencing homelessness, this is the protocol we want you to follow. We want you to call this number, and we're going to send somebody out there to meet with them and interview them. But then there are other portions of the county, like I said, that they may be sort of boots on the ground and actively looking to engage anyone who is unsheltered on that night. So a couple things I want to point out. We have some counties that do a street-based count, and they do it the night of the PIT count. So they will be out on Wednesday night and into the wee hours on Thursday morning. For those communities who conduct their street-based count in that way, the question is going to be, where will you sleep tonight, or where are you sleeping tonight? We also have counties who, for other reasons, they conduct their street-based count in the middle of the day. It's based on oftentimes when they can get volunteers because it's heavily reliant upon county or staff of other homeless assistance programs, et cetera. For counties that conduct their street-based count during the day, you need to make sure that you're organizing your count for the date of January 24th. You are then going to refer back to last night. So the question then becomes for you, where did you sleep last night? Based on the specifics of your count, if you have questions around that, please feel free to ask. In addition to the street-based count, some communities also conduct a service-based count. In this case, there are staff or volunteers who sort of set up shop for the day or for several hours within locations that are known to provide assistance and services to individuals experiencing homelessness. This may look different in every community, but some examples of this are a drop-in center, a day program of some sort, a soup kitchen, a food pantry, the benefits office, a veterans center, and other mainstream social service programs. Again, it can be really anywhere that that you believe that individuals who are experiencing homelessness would go for assistance. There's a separate interview form for the service-based count. It won't need to be separate for the mobile apps. That is fine. But if you are using paper interview forms within your community, there's a separate form. Some counties do both. They do both a street-based count and a service-based count. The most important thing I can tell you about a service-based count is if you conduct a service-based count, whether it's you only do service-based, or if you do sort of a hybrid between service-based and street-based counts, you have to conduct your service-based count on Thursday, January 24th. Again, in this case, just like if you were conducting your street-based count during daylight hours, you would be asking, where did you sleep last night? And the idea there is that if you're doing a service-based count or even a daytime street-based count and it's noon on Wednesday and the temperature is obviously going to be cold on Wednesday night, that individual may be able to identify somebody who will let him or her or them, if it's a family, sleep on their couch, in a spare room, whatever the situation is. They may decide to enter shelter, et cetera. So the real idea is to ensure that we are not double counting anybody. So the third sort of method that I mentioned is a come and be counted event. This method it says here unsheltered youth count because that's really when we began talking about these types of events, but folks have been using them for populations broader than just youth. And really what the model looks like is to identify a particular date, time, obviously the date would be the 23rd or 4th, and location, and to have sort of an event. It could be that you've got food set up and folks can just come and have a meal and be interviewed. It could be that you have service providers from across the community coming in to provide resources or flu shots or socks or whatever it is. And folks, in addition to receiving some assistance, you conduct interviews with them. Again, this has come out of sort of looking at how can we strengthen our youth-based count, but really I think is proving to be quite effective regardless of population. The important thing about youth, though, is to ensure that if you are having such an event, that you've got that it really is sort of designed with youth in mind, right? That you are offering supports or services that are desirable or needed by youth. In this case, I would strongly encourage, if you're planning such an event or considering planning, that you identify and coordinate with youth from your community so that they can help you identify where is an accessible location that folks would be able to get to, what time of day makes sense, what are the needs of youth in your community who are experiencing homelessness, et cetera. Okay, Who is included in the unsheltered count? Families with children, couples, married and unmarried, single individuals, sometimes it's groups of single individuals even, youth, whether, and youth here is being very broadly defined to include unaccompanied youth under age 18, unaccompanied youth who are between that 18 to 24 age range, which is the definition that HUD uses of youth up to and including age 24, and then parenting youth. That could be parenting youth who are under 18 or over 18, but it would be capped again at age 24 would be the extent. Okay, so just some general guiding principles of the PIT count. We really encourage you all to ensure, as county coordinators, many of you are, that these sort of messages are conveyed to folks in your community to really think about safety, not just the safety of the individuals who are volunteering, but also the perception of safety by the individuals who are being approached to be interviewed. It's extremely important that folks understand that their data is anonymous, that you're not requesting any information about their date of birth or their social security number or even their full name. If they, you know, we often get forms that have John or whatever the person's name is as opposed to their initials. If that's the information they want to provide, that's fine, but none of the information will be used to sort of track them down or to track them at all. It really is being de-identified and submitted to HUD as part of the entire COC's data. To the degree possible, this was a real issue last year, that complete information be provided. We're not going to use this year an observation form. On the front of the regular interview form, there's a section to say, basically where you would record the observation data if somebody is asleep or if they don't agree to be interviewed. But the observation forms were a real nightmare last year. We got so many folks who provided really nothing but saying, like, here's one person's form, so count them as one. The issue is, which we're going to look through in just a moment, the kind of data that we have to provide to HUD, it means that there is a lot of information that we have to then sort of make assumptions on, which is not helpful, and it does not contribute to an accurate count. So other things that we want to do, and we've talked multiple occasions throughout the webinar thus far about this, is that each person is only counted, each person is counted, and each person is only counted once. So for the sake of time, I'm going to sort of rush through the next couple slides, because most of this is information that you're going to get additional guidance on. So what is the information we're collecting? We're collecting information about the number of people in each household, their age, their ethnicity, their gender, their race. Additional information is collected on the number of episodes of homelessness they've experienced over the last 3 years. We're asking about the length of time folks have been homeless. That would include the current episode that they're in, as well as the number of months within a 3-year period of time. We're going to ask about domestic violence, but there's a change in the way that we're asking that question, which I think I have a screenshot as the next slide. And Maria's going to talk about that as well if I ever finish this presentation. So sorry, I'm moving along here. Disability status, we have a couple of questions specifically related to that, as well as veteran status. So this is just a quick screenshot of the new domestic violence question. I just want to say thank you to Maria, who really helped us to rethink what we're asking and asking it in a way that makes sense for folks who are survivors to know how to answer. So I'll just read the slide here. It says, for reasons of safety, please do not ask the next question in front of 2 adults who have identified that they are part of the same household. Note to interviewer, if 2+ adults are being interviewed together, skip this question. So that whole intro there is just a note to the interviewer. I'm not going to talk about why. I'm going to pass it over to Maria shortly, who can talk about that. The actual question is, did you need to leave the place you were last staying due to someone making you feel unsafe? Do you feel uncomfortable to return there because you feel unsafe? So this is really the basic question asking about domestic violence, but as you can see, the big difference here is that it's not using the terminology domestic violence in the event that that's not something that folks would, a term that they would use or perhaps be familiar with the actual definition or consider themselves to be that. We're also asking if for folks who are feeling unsafe, that you ask them if they would like to speak to someone who can talk to them about ways to increase their safety. The form is going to include, as you can see here, the National Domestic Violence Hotline. What I would say to you all as county coordinators for this is if folks are able to coordinate with their local domestic violence programs who offer to be engaged in this process and would be a more appropriate or an available contact in your community. Either A, I can provide you with the Word version of this so that you can edit that for your community specifically, or you can even just add it to the form before making copies for all of your volunteers. The survey goes on to say, if yes to feeling unsafe, thank you for letting me know. I have a series of additional sensitive questions to ask you. Is that okay, or do you feel like answering additional questions would compromise your safety? This is a completely new question. Again, something I had not really thought of in this way, so thank you to Maria for enlightening me. And I think this is a really important and good change to the survey this year. Okay, sheltered and unsheltered interviews. A couple things I just want to highlight. Don't need to read this entire slide. It's important that the interview questions be consistently asked. So please use the language that's provided. If you hate the language, just let me know, and we can talk about it for next year, but roll with it for this year, please. Inform folks who are being interviewed that their participation is voluntary. If they say at the beginning, yes, I agree to be interviewed, and by the end they do not want to be, answering certain questions, that's not a problem. If folks do not want to be interviewed, it's really important that we still document demographic information, which is required for each individual that we're counting. If a person refuses to give their initials, not a problem, assign it that. And this is one of the most important bullets on this slide. In terms of disability status, there should be no assumptions made. If somebody doesn't want to answer the question, then that can be noted on the interview form or within the app. But folks should not, volunteers should not be assigning a disability to folks. And in addition to that, cannot ask any sort of questions regarding the nature or the severity of disability. The other thing I'll sort of emphasize that's not specifically written here is that those questions have to be asked of everyone. Again, not everybody will answer those questions or needs to answer, that's optional. But it's important to emphasize to the volunteers participating that, oh, I'm only going to ask somebody who looks like this type of question. If they're sitting somewhere talking to themselves, I'm going to ask them about mental illness. But if they're not, I'm not going to do that. That's something that is absolutely forbidden in terms of the guidance from HUD, and I would argue is just not best practice. So again, all questions specifically related to disability, all questions in general should be asked of everyone regardless. And with disability, no questions regarding the nature of the severity. I had a lot to say about this particular slide, key partners in the PIT count, but due to time, I'm just going to say that if you are looking for opportunities to partner with any of these or other partners in your community, or if you have interest by any of these groups or other groups and you're not sure how to sort of incorporate them into your process, please feel free to reach out to further discuss. Counting veterans, this is something that's been emphasized for a number of years. Both the Eastern and Western Pennsylvania continuums of care are actively working on submitting claims to the U.S. Interagency Council on Homelessness, indicating that we have developed a system that is responsive to ending homelessness for homeless veterans, and that system looks to identify an individual who is a veteran and homeless as quickly as possible and connect them to permanent housing resources as quickly as possible. We've had significant reductions in the number of veterans identified over the years, and more importantly, the amount of time between identifying a veteran and placing a veteran has been expedited extremely. So who counts as a veteran? Really anybody who served in the U.S. Armed Forces or was activated into active duty as a member of the National Guard or the reservist. It doesn't matter about their discharge status or anything like that in terms of counting veterans for the PIT count. We have some resources there that are designed to help you better coordinate with the veteran system. Those are all listed in the booklet for the unsheltered count, and I'll make sure that when some of the other documents are distributed, the specific link for that booklet is also provided. Standards for counting youth, this is something that we developed a couple of years ago. It's still in effect. It's a couple-page document, and again, we'll make sure that this is distributed as well. This includes 5 key elements, and we ask that all counties really adhere to this, and if there's certain elements that you just cannot meet, feel free to reach out, and we can try to identify opportunities to assist around that. These include coordination with other systems that serve youth, engaging youth in the process, whether that's to help conduct the count, whether that's the planning of the count, et cetera. Identify hotspots. Those would be considered, anywhere that you know that youth are known to congregate or likely to be or have been seen recently or a likely location. Plan with safety in mind. This is important regardless if somebody's a youth or not, but youth are extremely vulnerable as an unsheltered individual, and it's important that both you think through the safety needs of your volunteers, but also what it must be like to be a youth and approached by an adult or a group of adults looking to ask you questions, especially if you're under 18 and have some type of fear around, being turned into children or youth or whatever the situation is. Provide local training, again, to the degree that your community can identify somebody who works with youth that can really help to further provide any additional or supplemental training on approaching youth during the unsheltered count. I think that would be something that would be strongly encouraged. HUD, there's been such an emphasis on youth. There are just an unbelievable number of resources. These are just a couple of examples, but again, we'll make sure that that these are posted and made available. These are often posted on Workplace. I know Brendan posts several of these, as does Christy from my staff, and among others. Counting unsheltered youth, things that we do is to make sure that the folks, the ECYA, the regional coordinators of the Education for Children and Youth Experiencing Homelessness program, to make sure that they're aware of the PIT date. Hopefully they are coordinating locally with you all, as well as the homeless liaison, the local homeless liaisons. We will provide information to the state children and youth in hopes of encouraging the participation among local child welfare workers. And if you have additional questions, as I already said, please reach out to us. These are just some of the resources that we'll be sending to you shortly. This is specific to the role of the Unsheltered County Coordinator. By February 13th, 2019, there will be a county summary form that needs to be submitted to our office. We'll be asking you to submit all interview forms collected. That says and observation forms. That's an error because we're not going to use observation forms this year. The number of homeless households reported on the summary form must equal the total number of interviews and observation forms. Again, that's not correct this year. The other thing is if you are using the mobile app, that will in fact impact the number of interview forms, if any, that you have to submit. So this is my contact information, and I have some additional information in response to some questions that have already been submitted. If we have time, I'm going to talk about those at the end. If not, I will send out an email that is sort of a Q&A based on the questions that we've received thus far. One of the things I want to say before turning it over to Maria and then Brendan is for your unsheltered count, if you are using the mobile app and have questions, if you have questions specifically about the app, the best person to contact is going to be Brendan. If you have questions about whether or not your community should use it and how to best go about that, I'm happy to discuss that, and I would assume Brendan is as well. What I would like to suggest is if you are considering using the mobile app, but don't have access to sufficient technology to deploy all of your volunteers to go that route. I think what would be advisable would be to determine which groups or teams are going to pilot the mobile app and to be very sort of specific around this team is going to use the app, everybody else is using paper, and that information just needs to be understood by all volunteers. So you don't have sort of different people and unknown to you randomly deciding to use the app or not. I think that increases the chances of chaos significantly and increases also the potential for duplicating data. And so thoughts around that, you know, like every other part of the PIT count, I would just encourage careful planning and consideration in terms of how the mobile app is used. I think it's a great opportunity. It will save our office significant time with data entry. I think it could increase the validity of our data as well. There's so many benefits to it, but I just think that some careful planning needs to go around, especially in this sort of inaugural year. So with that, I'm going to hand things over to Maria Williams to talk to us about domestic violence in the PIT count.
Great, thanks. Good morning, everyone. My name is Maria, and I'm the housing specialist at the Pennsylvania Coalition Against Domestic Violence. Thanks so much for having me on the webinar today. I appreciate it. Do I have control of my slides?
That's a Brendan question. If not, you can tell me and I can push a button.
Yeah, we can either do that, or I can give you the opportunity to share your screen and you can control it yourself, whichever you would prefer.
Lee, can you just flip these for me?
Absolutely.
Okay, thanks so much. So today we're going to talk about domestic violence and homelessness and why the connection exists and why it's important to talk about. We're going to talk a little bit about why domestic violence organizations should participate in the PIT count and the opportunities that lie there. And then finally, and where we'll focus is on engaging survivors the night of the PIT count, and then focusing specifically on safety, confidentiality, and a trauma-informed approach when you're interacting with survivors or really anyone that you might come in contact with on the night of the PIT. So domestic violence and sexual assault and human trafficking are all patterns of coercive power and control. And what that means is that someone external to another person is enforcing behaviors and expectations that result in one person having power over another in a relationship. That could be a one-time instance, like we see in some sexual assault cases. It could be years of ongoing coercive power and control, like we see in domestic violence. Or it could be someone forcing another individual to do things that they may not want to do in an effort to bring in money or drugs or et cetera, as we see in human trafficking. So all of that falls under coercive power and control, but each situation is different. It's important to remember that an abusive partner's behavior will deeply impact a survivor's ability to increase their own safety and to cope with the violence that's happening to them. And that survivors have fears that go far beyond just being physically safe in their home, even though that's where we often focus. Many survivors experience marginalization in lots of other ways, and that could be losing custody of kids, fear of deportation, fear of being outed to their family, fear of a variety of things that could keep them in that relationship. So domestic violence is one of the leading causes of homelessness for women and children, and when we talk about that, we can talk specifically about family homelessness in the United States. Data varies pretty significantly about how much the cause of homelessness is domestic violence for families, and we can see anywhere from 90% to 50%. And we know that data for DV survivors isn't as great as it should be, and that's something that I want to talk to you all about today. So we know that if we're interested in ending family homelessness, really looking at domestic violence is an important key to that. So oftentimes when a survivor is needing to leave a relationship, they're the ones that end up leaving their home, which is one of the many unjust things that occurs for survivors, but is a reality. We also all know that evictions happen to marginalized folks all of the time, and oftentimes a survivor could be evicted because of the behavior that's out of alignment with a lease from the abusive partner. Oftentimes, if there's a long history of abuse, credit can be ruined, or you can have poor rental history because of evictions, because of an abusive partner. That can lead to an inability to access housing in the way that most of us are able to. And then abusive partners, more often than not, will also sabotage a survivor's ability to pay rent on their own, to make deposits on their own, and that sort of thing as part of a pattern of coercive power and control. So survivors may be sleeping outside, and in fact, I can promise you that you will encounter survivors when you're doing the PIT count. That can happen for many reasons. Domestic violence shelters often lack capacity to serve everyone that needs to be served. DV shelters are an essential part of a homelessness response system, but survivors may not be able to get in because the shelter is full, or the format of the shelter, if that's a semi-communal format, or the idea of living with other families isn't something that works for them, so it may not feel like a good option. The National Network to End Domestic Violence does an annual survey, much like the PIT count, that talks about survivors in need of housing, and what we found is that half of survivors that seek housing, or excuse me, that only half of survivors that seek housing when they make a call to a hotline actually get that resource. So that's a significant number of people that are going to be living without the resource they actually need. Survivors are faced with the choice of either returning to abuse or coping with reoccurring homelessness with little hope of housing. So domestic violence organizations are essential to the PIT count and to any homelessness response system. And I really appreciate how here in Pennsylvania, and particularly in the Balance of State CoCs with the CoC leadership and Lee and Leah and Sierra's work, that the inclusion of DV in the system is a given rather than something that as DV providers we're all very used to trying to lobby for, which is fantastic. So I really appreciate the understanding of the importance and the connection to ending family homelessness. And given that opportunity, it's essential that DV programs in the Balance of State engage in this process, because this inclusion nationally is not common. And the ability that we can have with this PIT count to get a more accurate picture of what homelessness really looks like for survivors, particularly in rural areas, could make a huge difference for the resources that could come to Pennsylvania, but also for the resources that could exist nationally for survivors, because we're asking the question in a more unique way and because there is an emphasis on making sure survivors are getting the services they need. So this is a really incredible opportunity. It will also allow us to identify gaps in supports and services that already exist. Domestic violence organizations often, because of confidentiality and not wanting to assume that a survivor would want to be involved with a domestic violence organization, there isn't a lot of outreach and engagement that occurs. I think that we have a lot to learn from the homeless housing community about outreach and engagement. This is a really great opportunity to sort of practice that. And like I said, this, the data that comes from this PIT count could really allow us to ask for additional resources and establish homeless housing programs and systems that are responsive to the unique needs of DV survivors housing, unlike things that exist elsewhere. So the partnership is incredibly important. We all serve the same people, particularly in small communities. So not only will we get potentially excellent data from this, it's also a great opportunity for homeless housing providers to build relationships with the domestic violence organization in your community, both so you can cross-refer, but also when you're dealing with a situation on either end that a DV organization has someone that is homeless and really isn't in need of DV services, they know who they can call and pick up the phone and be able to refer a person and do that seamlessly. And vice versa, that if a homeless housing provider has someone that is dealing with domestic violence, you know you can call your local DV organization and they can be responsive. It's also a really, really great opportunity for the local domestic violence organizations to engage in doing individualized training, because what we know is that in each county of Pennsylvania, what domestic violence looks like is different than the next. And so we have an opportunity to really tailor what this training looks like. And so I'm going to give you sort of a broad stroke over that today, but engaging your local domestic violence organization in training for your individual county prior to the PIT count would be highly recommended. If you are needing access in either direction, either to your coordinator for the PIT count. If you're a domestic violence organization that is listening to this, please let us know and we can help make that connection. Or if you are a coordinator and don't know who to reach out to at your local DV organization, my contact information is at the end of this presentation and I'm happy to make that connection for you. So on the night of the PIT count, it is important that you actually ask the question for survivors if they are feeling unsafe, if they had to leave their home because they were feeling unsafe, and if they fear returning to their home because of safety. The question was worded pretty intentionally, and I'm excited to see how that actually goes over. What we know is that many folks that are surviving violence don't even identify with the idea that they're a domestic violence survivor, or they're a sexual assault survivor, or they're in the midst of human trafficking. Those are words that we've put on situations to try to make sense of them. What we know is that people experience violence in their lives every day, and that can look wildly different for each individual, and they may not identify with those terms that we use. So asking about safety on the whole and another person impacting one person's safety is really the key. So I would encourage you to just not be afraid to ask the question, that asking about safety is not going to compromise someone's safety, and in fact not asking could be far worse. Because in that moment, you also have the opportunity to connect someone who is surviving violence with the national hotline so they can reach out and get connected to their local domestic violence organization, or you may have the opportunity to actually connect them with the local DV org that night. So asking about safety in a respectful way could really also assist the individual in self-identification, that they may have never thought that the reason that they are currently experiencing homelessness is because of the violence in their home. They may think it's because of the series of events that they have chosen, which is a really common tactic that abusive partners will use to blame a survivor for whatever the circumstances that's occurring. So allowing a survivor that space to self-identify, I think, is really impactful. And like Lee said, we want to avoid asking a question about safety in front of both individuals of a two-adult household. That will be the thing that would compromise safety, so we'd ask that you would avoid that. So for yourself as a volunteer, what I want to make sure everyone understands is that these crimes that I've been talking about are a targeted act. This has been confusing in the last number of years as we've seen gun violence really increase, and reports about the folks that are using guns to commit violence. They are often also accused of domestic violence or sexual assault. What we know is that those are the outlying cases, that every day what we see is that an abusive partner's anger and control and tactics are very targeted at the person that they are trying to control. So you interacting with someone who is using abusive tactics to keep power and control in their relationship isn't going to be dangerous nor harmful to you. You're not the focus of that coercive control. So to continue to remember that, I think, is important. But what I do want to tell you is to trust yourself, and that if it doesn't feel safe, don't engage. If there's something going on that you can't quite put your finger on, but your gut is telling you that this is a situation that shouldn't be asked about in that moment, please, be attuned to that. And then as volunteers, I think it's really incredible that you have this opportunity to engage with folks that are experiencing homelessness, and there's a lot of trauma that comes up in homelessness, and it's important that you also make sure that you have the emotional support you need after hearing folks' stories and interacting with people that evening. So on the night of the PIT count, you as a volunteer are not expected to safety plan. But what I wanted to make sure that you all have the tools for is to know what, if the situation presents itself, could occur. And also remembering that just the act of asking someone if they feel unsafe and then believing them when they say they do can actually make a person feel safer. As I said at the beginning of my presentation, the physical violence that survivors experience is just really one aspect, and often in the survivors that I've worked with over the years is the thing that they say is the least concerning to them. It's actually the emotional toll and the mental toll that it's taken on them that has really done damage. And so just sitting with a survivor and when they say they feel unsafe and saying, I believe you, is essential and can really increase their internal capacity to make themselves safer. It's not your responsibility to make someone feel safe. It's an opportunity to ask a good question and make sure folks have resources if they need them. So if a survivor does begin to disclose to you what has happened to lead to this instance of homelessness for them, asking questions like, what has worked for you to stay safe in the past? And what do you need to do to stay safe tonight or tomorrow? And really making it very specific and pointed, I think, is important. Survivors have spent an incredible amount of time keeping themselves safe before they met any of us. So what we want to make sure that we do as folks that are here to help is engage that strength that's already exists within the survivor and remind them of that. if the survivor is interested, referring to the local DV program is fantastic because they're very well trained in safety planning and they can do this with a survivor. And this is a process that a survivor will go through. It's not a one-time event, and it needs to be very tailored to the survivor's life and daily activities, and every day may be different. So given the wide scope of that, what I just want to continue to remind you is that you are not expected to safety plan, but there may be an opportunity for you to help a survivor increase their safety in just a very small way. The second important piece of interacting with survivors is making sure that they understand that the information that they're sharing with you is confidential, and we talked extensively about this, so I won't get into it too much, but this is really where survivors can often shut down and remove themselves from a situation if they think that they're speaking with someone that could eventually talk to their abusive partner, and this is very common in small communities because everyone knows everyone, and so the risk is higher. So if a survivor is seemingly unwilling to answer questions, I would encourage you to just respect that and understand that and know that the impacts of trauma are significant and can often lead to assumptions being made that may or may not be true, but are true for that person in that moment. So I would encourage you just to follow the confidentiality guidelines that Lee has already set, and know that that is all the more important when you're working with survivors. Keying in on trauma is the third aspect of working with survivors and doing this survey process with survivors. So a real simple definition of trauma is that when the external threat overwhelms coping resources. For survivors, we know that this can be an ongoing state for years and years. It's challenging because of the PTSD symptoms that survivors can often experience, coupled with physical issues that may be going on to them, can really, really make it challenging for survivors to live in an emergency shelter space or safe housing or a safe house. This is often because of the communal or semi-communal nature, shared spaces, lack of privacy, fear of deportation or removal of children, like I talked about before. And a lot of that comes from the abusive partner's threats of saying, you know, if you go to that domestic violence agency, they're going to turn you in for whatever lie the abusive partner has made up. Oftentimes survivors will associate social service agencies with the federal government. And so if they feel like they are at risk at all about deportation or their children being removed, their engagement with a local DV organization and staying in shelter could feel like a really high-risk thing. Even though that's not true, it is something that many survivors believe, and so this may really result in survivors being unsheltered and being folks that you speak with on the night of the count. So this next slide is a list of how trauma can show up for folks. I won't get into it, but you may see any of these behaviors on the night of the count with anyone that you're speaking to, not just survivors, because we know that homelessness is an incredibly traumatic event for people. So if there are folks that are behaving in ways that you don't understand, what I want to encourage you to do is just come from a place of knowing that there's so much going on for these folks that we have no context for. And so remembering how trauma plays out, I think, is essential. So I would encourage you to approach everyone with kindness and compassion. If there is a survivor that is seeking support in the moment, really the most important thing that you can do is affirm their story and validating their fear. So even saying things to them, like if they say they feel unsafe and then they say, this is what happened to me, you don't need to do things to make sure that person is healed in the moment, because there's no way to do that. You don't need to do things to make sure that they're safe in that moment, because truthfully there's no way to do that. But asking questions like, what can you do to keep yourself safe tonight, are great. Or saying things like, I would be scared too if that had happened to me. I'm sorry that happened to you. I believe you. These sorts of things are really essential, and there's small things that you can do in the moment that will make a big difference. And then offering to connect them to their local domestic violence program or give them the number for the national hotline is important if they want that. I also would encourage you that if, when you're asking questions, that some of these questions are really uncomfortable to ask, and just speaking slowly and clearly and being really present with the person that you're surveying is essential. And again, and I've said this before, and Lee said this too, but if folks feel uncomfortable sharing, please don't press for information. That's their right. So if you are needing to connect with your local domestic violence organization, the PCADV website has an interactive map that you can go to your county and see who that organization is. You can also connect with me and I can help make that connection. If you want to read more about domestic violence and the connection with homelessness, this is a list of resources to do so. And if I can be helpful in any way to you, my contact information is here, and I'm happy to support in any way.
Great, thank you. Brendan, I'm not sure if you want me to advance your slides or if you're going to sort of take control of the presentation.
Yeah, I'll take control from here.
Okay.
Let's see here. If I can get this to switch back to me.
Should I push the button that says stop sharing?
Yeah, why don't you try that? Thank you.
How will I see your presentation? I should have asked that before now.
I'm going to attempt to share my screen if this will work for me. There we go. Actually. I apologize. Give me one moment. Haley, why don't you just share it for now if you don't mind? I'm having a little bit of difficulty. I'll see if I can get it resolved though. But why don't you share your screen just for my portion of the presentation for the PowerPoint? Thank you.
Also, if you decide it would be helpful for me to log out so that it defaults back to you, just let me know.
Okay. Well, again, thank you, Lee and Maria, for sharing that useful information. I'm going to be talking about the PIT app, which is a program known as ArcGIS by an organization called Esri, if you want to advance. So what is ArcGIS? GIS stands for Geographic Information System, which is essentially a cloud-based technology used for creating maps, compiling geographic data, and using that information to analyze and get a better scope of the geographic spacing. A lot of government organizations use this, private contractors, to really go out in the field and get a sense for what kind of geography is out there in their field. So there's a range of different apps that ArcGIS uses to collect and share this data. However, we're going to be focusing on Survey 123, which we use to develop the survey for the PIT count. So Survey 123 is a complete form-centric solution for creating, sharing, and analyzing surveys. We can use this app either on your phone, tablet, whatever mobile device you have, or on your desktop. And one of the cool features about it is you can use this app even when you're offline. So if you don't have service, you can still complete the app, and you can what you can do is essentially save it and resubmit it later, which I will show you later. And the results for the survey are actually filtered on real time to a dashboard that puts all the data into a graph automatically, and it makes it really easy to export the data to share with others. Additionally, I'll show you in my demonstration that the app lets you use your GPS location to track where you are taking the survey, and it puts that data into a map so you can see essentially hotspots of where the surveys are taking place. So why are we using ArcGIS? There are a couple different softwares out there to conduct the PIT count, but this one was recommended to be used by HUD. And in addition to that, DCED already had a contract with Esri to use their program in ArcGIS online, and an extra license was available, so we didn't need to go out and purchase anything. Virtually no cost to the CoC at this point for us utilizing this, which was excellent. And just reviewing some of the different applications that are in ArcGIS, I can see us potentially using this software more, depending on how the pilot program works out this year, to integrate into different aspects of our work in the CoC. More specifically, I think street outreach could really benefit from this, and people in the field who might be using the technology to go out and meet people where they are. So before the PIT count, you will receive a link to access the survey, and it'll give you an option to either open up the survey either in your browser or in the application. Now, if you give me a second here, I want to try to get it back to me, the host roles.
Do you want me to hit stop sharing again?
If you don't mind. I don't understand why this isn't working for me right now.
I have something on the bottom of my screen that says leave this training session. If I leave, will that perhaps make it work?
I actually figured it out. So I was logged in with my phone, and it made my phone the host instead of my computer.
Okay. This can't work. That's okay.
Nope,
but
we're good.
Oh, there it is. Okay. I was going to say I can't see anything. Got it.
So I just want to show you basically what's going to happen is you open the link, and it'll give you the option to open it here. But I am actually going to go back onto my phone and show you how it works through the actual application. Then I'll come back and show you in the browser. So I just want to acknowledge here that this is still a work in progress. I did develop the survey, or excuse me, there was a template that was already used by another CoC who created their own PIT count. However, me and Lee have been working very closely on this, and we decided that it'd be better to redo the survey and more have it closely aligned to what the actual PIT or unsheltered and sheltered interview forms look like. So I did go through and redo everything yesterday. So some of the stuff still isn't finalized yet. I'm thinking that towards the end of the once I have everything finalized, I will go ahead and maybe do another tutorial. But the app you can download for Android and Apple products. If you just go to the store and search for Survey 123, you are able to download the app. But again, it will give you the option to either do it in the phones or your electronic devices browser or in the app. So I will show you here. Once you click on the survey, you can actually look at the ones you have already sent. If you see at the bottom there, I did just a couple mock surveys to show you some data, but I'm going to go ahead and hit collect. And this will load the survey. So you see at the top the survey date. It'll automatically track the date and time for which you are doing the survey. And I just want to make a little note. One of the things I'm having issues with is that little error. It will pop up and say that for whatever reason I don't have a location, but it does work. So I need to contact Esri about that. But you're going to go ahead and put in your name here for the person completing the survey. Okay, and then in times throughout the survey, it'll just be like on the paper form. It'll give you essentially a script to follow and what to say to the individuals. So the first question you'll find is, can I have 10 minutes of your time? And I'll show you a couple different examples, but to set up the survey, there's basically logic. So if someone answers a certain way, it'll proceed to the next question or a different set of questions. So for example, if I would hit yes here, we will continue on with the survey. Did another volunteer survey already ask you questions about where you're staying tonight? If you say no, you can continue on with the survey. But if I backtrack just a second, can I have 10 minutes of your time? If I hit no, that'll open the observation portion of the survey where we will go and just get additional information. Oops. So I'm just going to go ahead and say that we are going to do the whole survey. No, no one asked me this. So it'll come up and say, where are you sleeping tonight? You'll just click on the box here, and it'll give you a list of options to select where they were sleeping tonight, or in some cases, potentially last night. So if you select any of the unsheltered locations, it'll continue on with the survey. But if you select, for example, emergency shelter, it'll ask you which shelter program you are staying in and how many are staying with you. But for the sake of this, I'm just going to select bridge or underpass. Moving on, it'll ask how many adults are staying in the household. For this example, I will just put in 1 for now. And then how many children, I will put in 0. So then we move on to the household questions. And it'll ask for the individual's initials. And then we were going to actually skip these first 2 questions. It'll say, how are you related to person 1? Skip for person 1. Since there is only 1 person, we will move past that. And I will just point out, if you notice next to the questions, you will see a little asterisk. That means that you need to answer that question before you can submit the surveys. So we'll just put in age, ethnicity, we'll just put in non, and then race. It'll say select all that you can apply, or all that apply in some instances, so you will be able to select more than one answer. And you don't need to click directly on the check marks. Just for a note, you can select click on any of the wording, and it will also include that. So what is your gender? And then here's where we start to get into more of the determinations if they're chronic or not. When did you last sleep in the following locations? You can select whichever applies. In the past 3 years, how many different periods of time have you slept in a shelter, car, etc.? So here's an example where if they select 1 time, this is only my first and only time, you'll just proceed with the survey. But if you select 4+ times, it'll give you another question. So in the past 3 years, how many total months have you slept in a shelter?
I just want to jump in to say that's one of my favorite parts of using the app. For those of you who I hope will pilot it this year, is that some of the if-then that we have to ask in a paper form, that branching can happen more seamlessly in the app, which I think is really helpful to the volunteer who's conducting the interview.
Right, and this gives us a lot of opportunity to customize the survey to fit exactly what we're looking for. Again, since I just built this yesterday, it's not finalized. There is still some more customization I'm going to be putting into it that'll break some of these questions down by either COC or even county level data. So that'll be really helpful. So here's where we get into the safety questions that Lee and Maria both emphasized about feeling unsafe. They have the question there. Again, it'll have that little note, which I underlined, italicized, I bold to really make it stick out, that you only want to present this question if they are alone, and again, use your best judgment to whether it is a safe time to ask them that. So if the question says, do you need to leave the place you were staying last night due to feeling unsafe, if they select yes, you will get a question that comes up, would you like to speak with someone who can direct you to increasing your safety? And it'll give you the National Domestic Violence Hotline question. And then they'll have a little prompt to say, thank you for letting me know I have some additional sensitive questions to ask. If they don't feel comfortable and they hit no, that would be the end of the survey. If they are comfortable with it, it can continue on. And even if they hit no, you'll just skip all of that for feeling unsafe and continue on. Now, these questions will only be asked to those individuals 18 and older. And it'll ask questions such as if they use drugs or non-controlled substances, psychiatric evaluations, or a question, physical disability. Do any of these situations that I just mentioned, do they have any prevent you from getting a job or living stably housed? If you select yes, it'll ask you which one applies, which I'll need to do a little bit more tinkering around with that logic behind that one. Have you been diagnosed with a developmental disability? AIDS question, SSI, and then we get into veterans. Did you serve in active duty? If you select yes, it'll ask you if you're eligible for health care from the VA, and it'll also give you the VA National Call Center for Homeless Veterans question. You can submit that. So here's where I told you about the location. It'll automatically track where you are at when you start the survey. I pulled it up here, but just give it a second to load. So that's currently where I am at. So it'll automatically track it up and pin your location. But let's say, for example, you don't have access to service at the time. What you can always do is you'll see the little check mark at the bottom right-hand corner. Once the survey is completed, you will hit that button, and it'll give you a couple options. And I would just want to apologize. I know this is a little laggy compared to what's on my phone, casting to the screen, but it'll give you the options to send later, send now, or you can continue the survey. So what I will do in this situation is send later, and it'll take you back to the home screen. If you want to continue taking another survey, you can go back and hit collect. However, if you hit send later, it'll give you the option to go into your outbox. So you can always go back into your outbox at a later date, or a later time rather. Click on it and pull the survey back up. It'll say the survey is completed. Do you want to edit it? You can say yes. So if it didn't pick up your location at that time, you can go back into it and go to the location and re-enter it essentially. You can go to the map, click on it, and change the pin by clicking and dragging on your device. So let's say we were actually up here in northern Dauphin County. I can change it to reflect that. So then I'll just go ahead and submit it. It looks like it didn't save some of my answers, so that's something I'll have to go back and address. But this is a general gist of what that kind of survey looks like. I do want to show you a couple other things with it. So I'm going to start a new survey here, and I'll just go through the observation aspect of it. So it'll ask, can I have 10 minutes of your time? I'm going to hit no, and that'll take me into the observation, and it'll get prompted with the little quote or a little note for the interviewer to not disturb the household if you cannot get their time, and just take down the information that the survey is asking. So it'll ask how many adults are in the household, an estimated age, how many children under 18 are in the household, number of males, number of females, and then also get their ethnic and race questions in here as well. And you would just hit submit once you have that completed, and that'll send it as an observation. So that sent the survey to the dashboard, which I'll show you one more second. I know I'm running out of time here. Before I have to let you out, there's just one more thing I want to show you in the actual app. So we're going to do one more time, just go through a regular interview. So when it asks the question, how many adults or children are staying with you, if you put in, let's say, 2 adults and 1 child, it's going to go through and ask for your initials and everything, all the normal questions. However, you're going to have to do that for each individual. And you'll see as I scroll through here, I'm just going to skip all the questions. And again, I'm sorry for the delay. Just broadcasting from my phone to the computer slows it down a little bit. But you'll see once you complete the survey for the first person, you will just hit the next question, and you'll see there 1 out of 3, you will do it for the next person. I didn't answer the questions, so it prompted me to go back and answer it. I'll probably do that again, yeah, because I didn't answer any of the questions. But essentially, you will go through and answer these questions for each individual, and then go to the next person and do that for each individual in the household. Now, there's some questions that I need to tweak so that they only appear at certain times, and that'll be in the final product. So I'm actually going to close out of the app, and there's just one more thing I want to show you guys, which will be on the dashboard, which will be on the back end that we are looking at. I want to show you the map and everything associated with that. So let me find. Oh. There we are. So again, I'll just open it up in the browser quick. It looks very similar. It's just slightly different from how the app works. It'll still do the same questions, same responses, and you'll just go through and do the same thing. So here's what the dashboard.
Oh,
yeah,
okay,
go ahead.
Sorry.
No, go ahead.
On the previous tab that you were on,
Yeah.
I know it's not the focus of today's webinar was the unsheltered, but could you go to where it shows emergency shelter? Just because I mentioned that this is something that the emergency shelter and transitional housing programs could use.
Yes. So where it asks where you're sleeping tonight, you can select emergency shelter or transitional housing. And again, I'm going to customize this a little more. You'll see it has 2 questions right here. Right now, there's one for the east and one for the west. However, I'm going to make it so that it will narrow it down to specifically target one or the other, and then even customize a little bit further to focus on just emergency shelter or transitional housing programs. So you'll be able to go in and select which county that you're in and which program that you're reporting for. And I will also show, I did a little more customization around the hotel motel. So if they select it, if they are in a hotel motel who paid for the room, you can select an answer there, which is a nice little touch. Great. Yeah, moving forward again, here is what the dashboard looks like. You'll see just kind of an overview here of the records, how many people participated, which in most cases is just me, the dates that they were submitted on, etc. But here's where it gets a little cooler. If I go under the Analyze tab, it'll take all the questions and put it into easy to read charts and graphs to better understand and look at the data. So these are just a couple of the questions that it covers based on the records that I put in. So we'll scroll through here quick and just give you a quick glance at that. And then additionally, if I go under this Data tab, this is where it pulls up the map. So you'll see here, when it takes my location, it actually puts points on the map as to where the surveys were done, which will give us kind of a better understanding of, okay, here's where we need to start targeting street outreach, or for next year's PIT count, we should start looking here and focusing our efforts here. So this data set really gives us a better understanding of what's going on in the CoCs and across the state. So I'll just scroll up here. You can actually go through, and I don't know why this portion of it is so big, but you can look at the different records, and let's say I pull up this one, it'll give you the surveyor name and kind of go through that individual question or that individual survey that was submitted, so we can examine it that way. And then just for exporting the data purposes, I did run a couple exports, so we will be able to export it and share it in the form of either a CSV or an Excel spreadsheet, just to give you that idea. I pulled that up to give you guys that example as well. So I'll look to see if there are any questions, because I have about everything I wanted to cover at this point. Lee, I know there was a question that would be geared towards you. So if you have anything, we have a few minutes yet, feel free to ask. But Lee, Chris Cap asked, we had a trainer last week who said someone living in a shed in someone's backyard is a viable permanent housing solution. Is this correct? Because it seems like a shed would count for the PIT.
So, Chris, that's a good question, and I think it depends on a number of factors, right? So I would like to say, yes, a shed is unsheltered, or no, it's not. But the reality is that when I've had these conversations with HUD, this is sort of the level of detail that they ask in order to make a determination of things like this. They will ask, does the shed have running water? Is there electricity in the shed? More importantly, is there a heat source? It's January in Pennsylvania, so even more so than the electricity, the issue would be around water and a heat source, things like that. So the answer is it could go either way depending on the specifics of the situation. If the shed does not have a heat source, I will just say, and I would assume it's quite cold, then I think it would be fair to assume that it is an unsheltered situation.
And then we have one more question from Amy Rosman. This could be for both Maria or you, Lee. If we are not domestic violence staff, shouldn't we contact the local DV center to continue the questions instead of asking ourselves?
So I'm definitely happy to defer to Maria here, but I guess I'm not clear what it means to continue asking. I think that at least the survey was designed to be used by any volunteer, whether that's a volunteer from a DV organization that's participating in the unsheltered count or not. I think that the way the questions are worded are really accessible to anybody. But Maria, I don't know if you want to add anything to that.
That's absolutely the case. And in fact, like they were intentionally done that way. So just ask the question and know that you don't need any additional training to ask those questions.
And I think
it's the referral that's more important.
Yes. And then she wanted to follow up and said, once we determine they are DV, should we immediately refer?
You should only refer them if they are interested. So just ask the question if they're feeling unsafe, if they identify they're feeling unsafe, and you say, would you like the number to the national hotline, or would you like to be connected to the local DV agency? It's completely optional, completely up to them. But offering that is the essential part.
Okay. And then Mike Ritter had a question. I assume the app, using the app is not an all or none model. So how will data collected via the app versus paper form be integrated? That is something that we are going to have to discuss with Lee. I don't know if there is a way for us to import data into the survey without actually taking the survey, but certainly we will be exporting it all, and Lee at the end of collecting all the data will put out a final report that shows the numbers broken down by current year into categories and by county, I believe, and by CoC compared to last year's numbers as well. And I don't know if you want to speak to that anymore, Lee.
Yeah, I mean, I think that one of the things that I can do to better respond to this is to spend more time looking at the dashboard, and if there is a way to make the dashboard public. So, for example, if Lebanon decides to use the app for the entire unsheltered count or even portions of the unsheltered count, how many people were, obviously the goal would not be to have to complete 2 surveys, a paper so that you have a record, and the online, the mobile app, so that it's submitted that way. But will there be an opportunity for folks to look at the dashboard publicly and determine, okay, we collected data on 10 folks through the mobile app, and 5 people from paper, so we had 15. I don't yet know that I haven't spent much time with the dashboard. We've been more focused on getting the survey questions right, but that's something that we can come back to. In terms of using the data, regardless of data source, the data will be just exported via CSV files, Excel files, and will be merged on our end to create a complete count for each county and then each COC. But I think that's a really good question that we need to figure out how to make sure that that is accessible. I just want to emphasize that as many folks as feel comfortable to use this app, I think it's a really great opportunity. I think the data collection will be cleaner. I think the data collected will be more accurate. I think there's a lot of potential for us to more thoroughly de-identify data. We literally sit around a table looking at forms, trying to split hairs that should not be split to ensure that we are, in fact, counting every single person that we believe should be counted, and on occasion needing to remove somebody from the count if we feel very strongly that duplication exists. By using sort of those GPS coordinates and things would really help us to streamline that process and make sure that we are, in fact, counting everyone and not double counting anyone. At this point, there's no process by which we have a situation in place where we can assist with mobile technology. We included this for those of you who took the online survey. We included some questions around that. So, for example, does your organization have access to mobile technology? Perhaps your library has technology that can be rented. Folks are welcome to use their own personal technology as part of this if your organization does not. I think it really just needs to be integrated into the planning process to determine if your county is going to use it all, and then the scope to which you're going to use it. Is everyone going to use some type of mobile technology, or, like I said, are certain teams of volunteers going to be using that? And I think as organized as you can be, the better the outcome will be on the back end.
I know we're over time. I do just have 2 more questions that I would like to answer. Lisa Spencer asks, can we use the mobile app over the phone if we can't get to a youth in particular that we know may be doubled up, or do all of these have to be face-to-face?
So I think if you have a very specific situation about doing a phone-based interview, I would like to talk to you. But in terms of doubled up, no youth or not youth would not be included in the sheltered or the unsheltered count if they were doubled up. It's not one of the eligible locations. Mm-hmm. That being said, if folks have questions, they foresee that as being something that they're going to get a phone call from somebody saying, there's an unsheltered youth, or anybody really who's unsheltered, give me a call so we can really talk that through. I'm hesitant to say yes or no without better understanding the full context.
And one last question from Sarah Reynolds. She asked, can I show you how to sign up for the Survey 123 app? There actually is no signing up required for this. The way that I have enabled the surveys to be shared through that link means that it's open everyone for the public, so you do not need to have a Survey 123 account actually. All you would need to do is go to the App Store and download the app. Or again, you can just do it straight from your browser. I enabled it to give you the option to choose which you would prefer to use. So again, there is no signing up needed for Survey 123. You just get the survey, download the app, get the survey link, and then you can get access to the survey.
Great. So, and if there's no more questions, the one thing I just want to add is that over the last year, we got a number of questions related to the role and responsibilities of mandated reporters. And I have a couple slides that I chose not to incorporate into today's webinar, only because I think that some of the information is this is not my expertise, and I wasn't comfortable presenting it. And I think some of the information is very judgment-based in terms of, do we do this or do we do that, versus having very clearly defined rules. So the last thing I just want to add about this, if you have questions about being a mandated reporter and whether or not you are required to report folks who have children in their household who are unsheltered, feel free to reach out to me. I think more importantly, what I would like to encourage folks to do is to reach out to their county children and youth office and to determine in advance of the PIT count what the response is going to be. What I mean by that is I spoke to the folks at the state, the Director of Children and Youth, and was encouraged to encourage you all to engage the county children and youth for a number of reasons, including the fact that those offices have access to emergency housing resources. And so perhaps in partnership, working hand in glove with the COC partner, there may be opportunity for the Children and Youth Office to provide a hotel motel voucher or some other type of resource for a couple of days or however long necessary, and then hopefully for that household to identify a more appropriate setting, whether that's with friends or family or to access permanent housing resources or whatever the case is. But what was strongly encouraged was for folks to partner with their local children and youth office in order to sort of establish what your county level protocol is. And part of the reason there is because it seems like there's a bit of controversy or lack of consistency in terms of how the corresponding laws that are define mandated reporter and their roles and responsibilities, as well as the law's definition of neglect. And so rather than saying all 53 counties should do X, Y, and Z, please make sure to talk with and coordinate with your county children and youth office.
Okay, if you have any other questions about the app or the PIT count in general, please contact either me or Lee. I want to thank both Lee and Maria for their time again today, sharing this information with you guys. The webinar was recorded. I will share it on Workplace with the PowerPoints in addition to our COC website. So again, thanks everyone for joining. If you have any questions, feel free to follow up.
Thanks very much, everybody. Thanks, Brendan.